Intersex people are born with bodies that are biologically slightly different than what we would consider typically male or typically female.
Hi, I'm a female. Or am I? Well, this is my story. I was short for my age, so I underwent tests to find out if there was a reason for my short stature, but the physicians didn't reveal the real cause. As my early secondary years rolled by and I watched my friends turn into women one by one, I remained defiantly prepubescent. I have further tests, and at last I was given a diagnosis.
It's a rare condition. You were born with male chromosomes.
Although I had uterus and fallopian tubes, my ovaries hadn't developed properly and could not produce eggs. There was a big risk of them becoming cancerous. At 15 years old, I'm still only 4 foot 8 inches. I had to inject myself with growth hormone every day for 2 years. Later, I was hit particularly hard when my younger sister had a baby. I knew that I was indeed infertile and would never be able to have children. A few years ago, I was diagnosed with osteoporosis caused by the lack of estrogen in my teens, but the treatment effectively led to a second puberty, and I became more curvaceous. At 40, I'm lucky to look much younger than my age. From the short animation, we know that the patient was diagnosed with a special rare condition. But what exactly is the condition? This is what we are going to talk about in our presentation. Swyer Syndrome, also known as 46XY complete gonadal dysgenesis, is a rare congenital disorder of sex development. As we all know, people with 46XY karyotypes who have the sex chromosomes Y will normally develop male sexual characteristics. However, people with Swyer syndrome have 46XY karyotype but phenotypically female, which means they develop female sexual characteristics. Now we'll look at the characteristics. People with Swyer syndrome have female external genitalia and some female internal reproductive structures. These individuals usually have a uterus and fallopian tubes, but their gonads are not functional. Instead, the gonads are small and underdeveloped and contain little gonadal tissue. These structures are called streak gonads. Due to the gonadal dysgenesis, they are not able to produce sex hormones, including estrogen and progesterone for the development of their secondary sexual characteristics. Consequently, they typically will not undergo puberty, a condition called primary amenorrhea, which leads to infertility. Now, let's look at some treatments for Swyer syndrome. People with Swyer syndrome are treated with hormonal replacement therapy, including the replacement of estrogen and progesterone hormones, the two main hormones that are produced by the ovaries. When possible, this therapy usually begins at the ages associated with puberty, specifically during adolescence, in order to induce menstruation and the development of female secondary sexual characteristics such as breast enlargement and body hair. Hormone replacement therapy can also help prevent the risk of low bone density, osteopenia, and fragile bones, osteoporosis during life, as estrogens play an important role in the growth and maturation of the bones. In order to mitigate the risk of cancer, strict gonads are often removed surgically to avoid a gonadal malignancy. Can people with Swyer syndrome get pregnant? Well, women with Swyer syndrome do not produce eggs, but if they have a uterus, they may be able to become pregnant with a donated egg or embryo.
So, what are the causes for Swyer syndrome? In many individuals with Swyer syndrome, the cause is unknown. However, variants, also known as mutations, in one of several genes have been found to cause the condition in some affected individuals. Such mutations can be newly developed or inherited. Although, most cases of Swyer syndrome result from new mutations and occur in individuals with no family history of the condition. So, let's learn some of the causes. One of the causes for Swyer syndrome is the mutation in the SRY gene. The SRY gene, located on the Y chromosome, provides instructions for making a protein called sex-determining region Y. This protein triggers the differentiation of undifferentiated gonadal tissue into testes, leading to the production of male sex hormones, which are androgens, and the development of male reproductive organs. It also prevents the development of female reproductive organs. However, the mutation of this gene prevents the production of sex-determining region Y protein. Without functional sex-determining region Y protein, a fetus will not develop testes but will develop female typical internal and external reproductive structures, despite having an X and a Y chromosome. Another cause for Swyer syndrome is the mutation in the MAP3K1 gene. Mutation in this gene may account for 18% of the cases. This gene prompts the body to make a protein that helps control the processes of determining sexual characteristics before birth. The mutated MAP3K1 decreases signaling that leads to male typical sex development. This causes an increased signaling that leads to female typical sex development. These changes in signaling prevent the development of testes and allow the development of female reproductive structures. Next, the mutation in the DHH and NR5A1 gene. The DHH gene provides instructions for making a protein that is important for early development of tissues in many parts of the body. The NR5A1 gene produces a protein called steroidogenic factor 1 that helps to control the activity of several genes related to sex development and the production of sex hormones. Mutation of these genes disrupt the process of sex development, preventing affected individuals with a 46XY karyotype from developing testes. This causes them to develop female reproductive structures instead. Lastly, one of the causes for Swyer syndrome is inheritance. Cases of Swyer syndrome due to mutation of the NR0B1 gene may be inherited in an X-linked pattern, which means that the genetic mutation is located on an X chromosome and is most often inherited from the mother. Meanwhile, SRY gene mutations follow a Y-linked mode of inheritance, which means that the genetic mutation is located on a Y chromosome and therefore is exclusively inherited from the father. So, let's recap all that we've learned. Swyer syndrome is a disorder of sex development in which an individual with 46XY chromosome develop female characteristics with strict gonads. This syndrome is caused by genetic mutation and is rarely inherited. Individuals with Swyer syndrome cannot produce sex hormones and is considered infertile. These individuals need to undergo hormonal replacement therapy to develop their sexual characteristics and surgery to remove the strict gonads that have risk to become cancerous. Now, let's test your understanding of the topic. Read each question carefully and select the best answer. You may pause the video and take your time in thinking of a suitable answer. Below are the characteristics of people with Swyer syndrome except A. Have female external genitalia, B. Cannot be pregnant, C. Has a Y chromosome, D. D. No functional ovaries. The answer is B. Cannot be pregnant. This is because a woman with Swyer syndrome may become pregnant with the help of a donated egg or embryo. Next question. Swyer syndrome can be treated by A. Ligation, B. Enzyme replacement therapy, C. Bone marrow transplant, D. Hormonal replacement therapy. The answer is D. Hormonal replacement therapy. This consists of the replacement of estrogen and progesterone hormones, the two main hormones that are produced by ovaries. This treatment induces development of female secondary sexual characteristics. That's all for this video. Thank you for watching. Hope you have a good understanding of Swyer syndrome and its details. These are the references used in the making of this video.